welcome to the deep dive.
Yeah.
Today, we're tackling something really fundamental, the role families play in healthcare.
Absolutely. It's critical, but often flies under the radar.
Yeah, exactly. We've looked at materials from, all over healthcare providers, accreditation bodies like JCI and NABH in India, even consultancies like Supremedic.
Right.
And our mission today is pretty simple. Boil down how family support really impacts health outcomes and what that means for you.
And for you, the listener, someone who wants to get a solid grasp on things quickly, this isn't just about, warm feelings, family involvement. It actually has a measurable effect.
Totally.
So we want to give you insights that are genuinely actionable, not just fluff.
Okay, let's start right at the foundation then. It seems obvious maybe, but families aren't just visiting hours, right?
Not at all. They're fundamental to the whole healthcare experience.
They bring that emotional support network, the practical hands-on help.
And they often become the strongest advocates a patient has. It's this combination that really seems to lead to better results, a more positive journey.
Let's break that down a bit. Emotional support. What does that really look like?
Well, it's more than just being physically present. It's actively providing comfort, that reassurance, helping patients deal with the stress, the anxiety, the fear that naturally comes with health issues.
Right, like having someone in your corner when things feel scary.
Exactly. And studies actually show that feeling supported emotionally can mean less pain, faster recovery.
Makes sense. Then there's the practical side. The real nitty-gritty stuff that gets tough when you're unwell. Help getting around, making meals, keeping track of meds.
Oh, yeah. Managing those complex medication schedules, multiple timing.
And just getting to all the appointments. It's a lot.
It really is. And taking care of that frees up the patient's energy, mental and physical, to just focus on getting better. There's even research suggesting strong practical support at home reduces hospital readmissions quite significantly.
Wow. Okay.
And beyond that, families often step up as advocates and communicators.
Making sure the patient's voice is heard.
Precisely. Ensuring their needs, their preferences get communicated clearly to the doctors and nurses, and also helping to translate complex medical information back to the patient and maybe other family members too.
That communication piece feels so empowering.
It is.
When the family really understands what's going on, the condition, the plan, they can support much more effectively, make sure things are followed.
Yeah, and even encourage independence where possible. It's like a positive cycle. Understanding leads to better action.
Right.
And this also feeds into care coordination.
Connecting the dots.
Exactly. Families are often the ones linking patients to resources, making sure care continues smoothly between, say, a hospital and home or between different specialists.
That coordination can save a lot of hassle and maybe even prevent problems down the line.
It really can reduce delays and complications.
And then the big decisions. Treatment options, future care, even end-of-life planning. Family involvement there is just huge.
Absolutely critical. It's about making sure the patient's own values and wishes are front and center, that they're respected in those conversations.
And finally, just supporting the recovery itself, the encouragement, the motivation.
Helping patients take ownership of their rehab, regain their independence. It's all part of it.
It's so multifaceted when you lay it out like that.
It really is. And, thinking about that Lifelines podcast, especially in the Indian context.
Oh, right. They talked about how deeply involved families are there.
Yeah, it's not just accepted, it's expected. Right from the start, they had this great line, doctors diagnose and treat, but families observe, support, remember, and often decide.
That really shifts the perspective, doesn't it?
It does. It makes you see the care team much more broadly.
So it's not just about the clinical moment, but the whole lived experience. Which leads us nicely into the practical roles families play at different stages. It's not just one big thing.
Exactly. Think about before you even see the doctor. Our sources point out families are often the ones tracking symptoms.
How long has it been happening? How bad is it? Any patterns?
Right. And gathering medical records, past tests, noting any recent changes, appetite, sleep, mood. That groundwork is invaluable for the doctor.
That proactive role is so helpful. The Lifelines podcast suggested, a shared file or diary?
Yeah, especially useful for older patients or those with chronic conditions. A central log.
Smart. Okay, so what about during the actual visit?
Well, the advice is to be there for support, definitely. But let the patient speak first, if they can.
Don't jump in immediately.
Right. Clarify things respectfully if needed. correct a timeline maybe, but the key thing is taking notes.
Diagnosis, medications, the do's and don'ts.
Exactly. Get it all down.
And I love that practical tip from the sources, taking a photo of the prescription with your phone.
Oh, yeah. Super simple, super effective, instant record of doses and timings.
Okay, so then back home, the role changes again.
Uh-huh. Now it's about supporting adherence, making sure meds are taken on time, the diet's followed, tests happen.
And keeping an eye out for changes.
Yeah. New symptoms, side effects from meds, even subtle mood shifts. Just observing.
But, and this seemed important in the sources, respecting their independence too.
Hugely important. Allowing the patient to do what they still can, maintaining autonomy. It's about compassion, not control. A tricky balance sometimes.
I can imagine. Then, if a hospital stay is needed,
The family becomes a crucial communication hub.
linking the medical staff and the rest of the family?
Yes, coordinating things, trying to stay calm, especially if it's an emergency. And that Lifeline's tip about keeping a dedicated file for all reports and prescriptions right from the start of admission.
That makes so much sense in a potentially chaotic hospital setting.
Definitely. And then moving into recovery, the support doesn't stop at discharge.
No, it's ongoing. Follow-ups, physical therapy, lifestyle changes,
All need support to be maintained.
and the sources emphasize recovery is mental too, right? Not just physical.
Absolutely. Consistent emotional support after a major surgery or a chronic diagnosis or some trauma. It's vital for long-term coping and well-being.
Planning for the long haul too, home adjustments, diet, rest routines.
It all falls under that support umbrella.
Okay, let's shift gears a bit to decision-making. This can be sensitive.
It definitely can. And the sources, like Lifelines talking about India, acknowledge that cultural context where family elders often have a very strong say.
That's a reality for many listeners.
It is.
But even with that dynamic, what did the sources stress?
The fundamental need for informed consent, respecting the patient's own voice.
So even if family is heavily involved in discussions, the patient needs to understand and agree, especially for big things like surgery or intensive care.
Exactly. From an ethical standpoint, and practically too, it's about making sure they understand.
It's about helping them understand without adding more stress.
Right. And that Lifeline's advice was spot on. If things are unclear, ask the doctor to explain again.
Don't guess or just rely on Google.
Please don't. Just a simple, could you run through the options one more time?
Yeah.
Then make a huge difference.
Good advice. And tied into this is supporting mental health.
Yes. Chronic illness, pain, long hospital stays. They take a toll on mood, on motivation.
So families need patience, understanding.
Lots of it. The sources specifically warned against blaming the patient if progress seems slow. Instead, focus on acknowledging small wins, keeping routines consistent, offering support.
Sometimes just a kind word makes a difference.
A huge difference, more than we probably realize.
Which brings us to the caregivers themselves. Burnout is a real risk.
Oh, absolutely. The demands are huge. The sources really hammered this home. Share the load.
Ask for help. Take breaks.
Yes. Don't try to be a superhero. Get other family involved, maybe professional home care help if possible. Use reminder apps, whatever it takes.
Recognize your limit.
You have to. That Lifelines analogy was powerful. You can't pour from an empty cup.
So true. Caregivers need care too.
They absolutely do. Prioritize your own health physically and mentally.
The Supremedic Lifelines excerpt also broke down specific family roles, didn't it?
It did. They mentioned the primary caregiver, the one handling the daily stuff, meds, appointments, watching symptoms.
And reminded us they need support.
Crucially. Then the advocate, making sure the patient's heard, asking questions, maybe seeking second opinions, pushing for timely care.
Important role.
Very. Also, emotional and mental support, just being there, listening, comforting.
And one that's often missed. Financial support in planning.
Right. Navigating insurance, subsidies, managing the costs. That's a whole job in itself.
Understanding these roles helps see how the burden can be shared, maybe.
Exactly. It helps distribute tasks so all bases are covered.
But the sources also flag some potential problems, some pitfalls for families.
Yeah, it's important to be aware of things like overstepping boundaries, not respecting the patient's autonomy.
Taking over too much.
Kind of. Also, neglecting self-care leading to burnout, like we just discussed. Or inconsistent care, maybe missing med times or appointments because things get overwhelming.
And sometimes overlooking the mental health side for both the patient and the caregiver.
Yes, that's a big one too.
Just knowing these risks is the first step to avoiding them, I suppose.
It is.
So how do we build a really strong, effective family support system then? What are the keys?
Well, number one has to be clear communication, open, honest talks.
Everyone knowing their role, responsibilities, expectations.
Exactly. Regular check-ins to make sure everyone's on the same page, address problems early.
And number two, as we keep saying, sharing the load.
Absolutely essential. Delegate tasks. Don't let one person carry everything. It's just not sustainable.
Prevents burnout, keeps everyone healthier.
Right. And finally, encourage everyone to be involved somehow.
Even in small ways.
Yeah. Offering companionship, running an errand, just listening. It all adds up, makes a positive difference, and stops one or two people feeling totally isolated with the responsibility.
Okay. So wrapping this up, after this deep dive, it's crystal clear. Families aren't just sideline spectators.
Not even close. They are integral parts of the care team. Absolutely vital.
Playing all these different crucial roles across the whole journey.
Definitely.
And for you, listening, whether you're a patient now or a caregiver or might be one day.
Understanding these roles is empowering.
Right. It helps you give better support, advocate more effectively.
Navigate the whole complex system with maybe a bit more confidence and clarity.
Which leaves us with a final thought, something for you to mull over.
How can our healthcare systems and the professionals within them do better?
Yeah, how can they better recognize, integrate, and actually support family caregivers as the vital team members they are?
Especially now, with healthcare demands rising and this big push for patient-centered care.
Fostering that partnership seems more critical than ever. Something to think about.